Ladies and gentlemen, I'm Steve Evans. I'm the Chief Medical Officer for MedStar Health. I'd like to welcome everybody today to a day of celebration. There's an enormous amount to celebrate. Let's begin with, this is the 14th annual MedStar Health, Georgetown University Research and Education Symposium, the 14th annual. It is also an opportunity for us to celebrate the over 350 abstracts that are in this hall that really does simulate a national meeting. And behind every one of those abstracts is a team, a mentor, a mentee. It is ensemble medicine at its best. So let's celebrate all of those folks who have given us 350 abstracts. But we're here for a very special reason this evening, ladies and gentlemen. In this closing plenary session, we're here to celebrate the 25th anniversary of the partnership between MedStar Health and Georgetown University. And that is extraordinary. When I say celebrate, we talk about celebration and gratitude in the same vein. Grateful for all of the individuals who have invested time in asking the right questions, where science becomes more important every day, asking and answering the correct questions. In addition with that, the gratitude around what makes something like this work. And what makes it work is philanthropy. Grateful patients, grateful companies who work with us, and I want to recognize those companies today. Advanced Computer Concepts, the Bank of America Merrill Lynch, BFPE International, Crothall Healthcare, Deerfield Construction Group, and Gilead Sciences. More than ever, the challenges in research are very real. Financial impact on it, not insignificant, and so relying on these kinds of companies and grateful patients and gratitude is what helps drive and support foundationally our ability to put on programs like this and support our investigators. So thank you again to all of those companies and to those of you in the crowd who support what we do every day. As we celebrate these 25 years, it's also important to understand and recognize and celebrate what makes today also very, very, very special. And that one individual is Dr. Norm Beauchamp. Dr. Beauchamp is the new Executive Vice President for GUMC and has been here for about 10 months. And I've had the privilege of working with a lot of Executive Vice Presidents at Georgetown University. And what makes Dr. Beauchamp unique is his energy and his passion and desire to redesign how we make this partnership bigger, stronger, and more active and more productive. So Dr. Beauchamp, thank you very, very much for being here and being part of this. At MedStar Health, we talk a lot about strategy, research, strategy, leadership, and execution. We talk about it all the time. Our strategy is very simple: to be the best academic health system in the country in partnership with Georgetown University. How we execute upon that can be difficult and challenging even in the best of times. But I would tell you, leadership makes a difference every single day. And when you have a CEO who believes deeply in this mission, it makes a difference. When you have a CEO who increases the investments during the pandemic, to increase our investments in investigation, education, and research, that is what defines an individual who truly believes. And so it's my privilege, ladies and gentlemen, to introduce Mr. Ken Samet, our CEO and President of MedStar Health.
Good afternoon, everybody. It's really a pleasure to be here, spend a few minutes with all of you. What an impressive, meaningful day this is. I am truly blown away. That's a non-medical term, but I think you could understand by what I saw today the energy in the room, the commitment. And when Dr. Evans talked about 25 years and the partnership with Georgetown, and I teased Dr. Beauchamp, and without question, Norm, it's incredible to have you here, and it's so important. And I know I can share from Norm's story. Norm came, Dr. Beauchamp came because of the uniqueness of this partnership in the United States of America. It was what he was just starting to try and build in Michigan, and we have at least a decade head start, and we've lived through a lot of these moments. And I don't want to miss the chance to just recognize Jack DeGioia, who was my partner through the entirety of these 25 years of this partnership. And I will absolutely be sharing with Jack when I see him next how this day went, the magnitude, the impact, how partnership goes. And it really ties to everyone here, right? People matter, and leadership matters, researchers matter, people matter. MedStar, Georgetown University Medical Center, what is that? Who is that? Organizations are about people, and people make a difference. And so our friend Jack certainly did, and I want to give him a shout out today. And Norm, as I teased you sitting there, you showed up for the easy part, because now it's the fun part of getting to really think about what this partnership can do. And so welcome, and we're super excited about all of that. So, I'm always struck when I walk around, I see the posters, I talk to all of you. For a number of us, we're focused on perhaps things that are more challenging, discouraging relative to federal health policy and what's taking place in terms of how healthcare in America works. But we all got into healthcare because we actually cared about people, community, whether we were a doctor, a nurse, a researcher, an administrative person. Everybody hopefully came into healthcare for those reasons. And when I come away from this day, it is reinvigorating. And I think that I speak for everybody here. There's a hopefulness. Dr. Drass and I were saying there's young people who are so smart that are focused on making a difference in spite of anything going on out there. And the breadth of the research that I saw on the posters and talked to so many about is really encouraging to know that we're thinking about how to make a difference, touching everything from ICU towers and burn to how we admit patients in a clinic. You pick it, you're doing research on it. All of which, by the way, is going to make us better. And so when I come away from that, I think about, some folks have heard me talk a little bit about heart and head. And I think heart and head really matters in healthcare. So caring at a very basic level for all, but connected to intellect, experience, data. I don't often see both of those at scale, but I did today. And real change that matters over time, change that touches communities and patients in ways that builds trust for organizations like MedStar and Georgetown University Medical Center. Well, that requires heart and head. And for all of you, educators, clinicians, researchers, you have heart and head. I heard it today. I see it today. I see it every day as I walk across the organization of MedStar and on the medical center campus. And I thank you for that. So it is truly a privilege for me to get to just share a few words with you today and to talk about the importance and to celebrate research and academics at MedStar Health and at Georgetown University Medical Center. And as an academic health system, really important words. When Dr. Weissman's not in the room with me, I actually talk about it like I created those words. But since he's looking at me, I have to admit it was a presentation I saw him do, and it really deeply resonated. And no joking, all joking aside, when we think strategically, as Dr. Evans spoke to, being an academic health system requires a lot of an organization. That's additive, that's exponential to being a great academic medical center, to being a great university doing research. It is all of it. It is being able to take research and translate and connect that with pace to communities and patients and to make a difference. And if you think about the footprint of MedStar Health, the populations we touch look exactly like America. And isn't that what research and making a difference should be all about? And so that's today, right? Today, just as a capstone for what happens every day, it really does show you how those novel things are happening. And yet, it is really important to recognize that the work to advance health is taking place against a backdrop of a growing mistrust of medicine and efforts to stifle independent thought, academic pursuits, and scientific advancement. And over the past few months, as you all know, there have been many federal actions that have sought to reshape our nation's healthcare system, our health agencies, and even to have the government become involved in critically important research initiatives. So let me be clear with all of you today, our academic leaders, educators, and scientists. Just as equity, inclusion, and diversity are at the core of who we are as a healthcare system, education and research are foundational. Job one to allowing us to be who we are every day at MedStar Health. Advancing health is part of our vision statement, and we are intentional with how research and education can address key challenges for our patients so that we can improve the communities that we serve. Research and education are foundational capabilities in our strategic plan. They show up through clinical research in our strategic service lines. And the majority of our patients benefit every day from our commitment to graduate medical education. Recruitment and retention of our best and brightest clinicians is often directly related to our commitment to academic and research pursuits. And we're truly grateful to have Georgetown University as our partner in this work. Together, we are pushing boundaries of academic medicine, forging new ways to work together to find better solutions to the most challenging issues facing healthcare today, and creating new knowledge about the whole person. There's a lot in that sentence, and you think about how we're making a difference, and it starts on those posters, and it translates into every single clinical area and through our nurses, doctors, pharmacists, therapists, researchers. And so despite the headwinds of the moment, actually, because of those headwinds, we have to continue to advocate for why education and research is not a choice at MedStar. It is inextricably linked and embedded in who we are, and it is foundational for our being. It is foundational to a 25-year partnership with Georgetown University and Georgetown University Medical Center. So I want to share that in a re-encouraging way for you. The headlines are the headlines. Despite those headlines, there are communities and patients that are counting on us to make a difference, counting on you to make a difference. And that's exactly what you're doing. And I couldn't be more proud of you. Each of you, all of you, embody heart and head. And I thank you for that. And I look forward to seeing all the incredible things that will come from the research you're doing and to continuing to move forward together in the spirit of partnership. Thank you. Dr. Evans?
Thank you, Ken. Words make a difference. They make a difference in leadership. They make a difference in vision, mission, and passion for what we do. And we thank you, Ken, for those words, because behind those words is really intention and action. So now I have the privilege of moving us into this final session of our plenary and talking about the 25-year partnership, but looking back. Lots of lessons to be learned looking back in the last 25 years, because it will set the stage for what the next 25 years sets up. So I have the privilege of introducing our next three. Dr. Jamie Padmore is our Vice President for Academic Affairs and the Vice Dean for Education for Georgetown University Medical Center. And Jamie's going to do some introductions, but as the three of you all walk up, Dr. Padmore, Dr. Haramati, Dr. Drass, they'll come up and we're going to do a fireside chat. Behind Dr. Padmore is Dr. Joy Drass, Executive Vice President and Chief Operating Officer for MedStar Health. But at one time, Joy was also the first president of MedStar Georgetown University Hospital. Also hired me, by the way, as the chief of surgery at that time. Full disclosure. And next to her is Dr. Aviad Haramati, Executive Director for Centile, the Center for Innovation and Learning in Education. Full disclosure, Aviad Haramati and I came exactly 40 years ago this month to Georgetown University's campus. It's only 40 years, Adi.
And 2 months.
So with that, Jamie, I will turn it over to you and you'll start your fireside chat.
Great. Thank you, Steve. Joy, Adi, thank you so much for joining us in this conversation today. As we were planning the plenary, so many people on the planning committee, as we talked about 25 years, we realized they weren't here 25 years ago, and they don't really know the story of how we've come together. Before we start, I'd like to introduce both of our speakers who have extremely long CVs, and I'm going to be very brief. Dr. Joy Drass is our Executive Vice President and Chief Operating Officer at MedStar Health. Following her graduation from Georgetown University School of Medicine, she completed residencies and fellowships in surgical critical care and worked for 13 years at Washington Hospital Center as a surgical intensivist and in the MedStar Trauma Unit. She received her MBA from Wharton, and as Steve mentioned, she was the first president of Georgetown University Hospital following the acquisition of the hospital by MedStar Health. And notably, Joy's on the board of the ACGME, among many other honors. We are so delighted to have her representing GME nationally. Dr. Aviad Haramati is professor of integrated physiology, medicine, and nephrology at Georgetown. He's the co-director of the Integrative Medicine Program, Centile in the Teaching Academy at the university. He received his PhD from the University of Cincinnati and has spent 40 years and 2 months at Georgetown University. And at the time, I'm going to transport you now back to the year 2000, when Adi was chair of the Faculty Senate, the caucus of the Faculty Senate at the Medical Center. So if you all will, just indulge me for a second, let's go back to the year 2000. I think everyone remembers Y2K, which is what we were talking about all the time leading up to 2000. Faith Hill's hit Breathe was #1 on the charts that year. The camera phone was just making its debut, but I bet most of us in the room had a BlackBerry in our pocket. Reality TV was just making an appearance with Big Brother being the show of the day. Brad and Jen got married. John Paul II was Pope, and the St. Louis Rams won the Super Bowl. For those of you in the room who are residents, we're going to be welcoming about 350 in the next 30 days. Our new interns were born in the year 2000. Wow. And MedStar Health had just moved from being Medlantic Healthcare Group to MedStar Health and had merged with a 5-hospital system in Baltimore, which is now a 4-hospital system. And we were just becoming a healthcare system when Georgetown became our partner. So my first question for each of you is, take us back to 2000. Tell us what it was like in healthcare. What was happening on the national stage in healthcare? And what was happening in DC in the market?
So I think the word that comes to mind is disrupted.
Right.
In 1997, with the Balanced Budget Act, there had been significant reductions in Medicare reimbursement for hospitals and for providers. So that was a big hit to all hospitals. The second thing that was happening was it was sort of, I think of it as the rise of managed care, so that the commercial payers were becoming much more difficult to deal with in terms of getting appropriate healthcare procedures and different things okayed for patients. And importantly, they were also beginning to think about networks of hospitals as opposed to contracting with every hospital in a region. And if you think about academic healthcare hospitals in general, they tend to have higher costs. And so they were disproportionately hit by both of those, right? By the Medicare cuts that happened out of the Balanced Budget Act and by what was happening with managed care. So in my mind, it was a natural evolution of strategy that the university would be thinking about looking for a partner.
And Adi, what was it like on campus in 1999, 2000?
I'm just curious, how many in the room were actually at Georgetown at that time? Maybe 5%. So perhaps you'll indulge me a bit. I'm presenting a point of view of a faculty senate leader. And in the year 2000, we were actually in trouble as a university. In 1997, our hospital lost $53 million. In 1998, our hospital lost $63 million. And in 2000, our hospital had a net loss of $83 million. At that rate, the university was going to be bankrupt in a very short time. And as the faculty leadership, it wasn't just about finances, but there were also quite a bit of change that was taking place on the leadership side. We had several key leaders depart, and there was a sense of unease that actually started back in 96 and then moved into 98 and 99, that we needed stability. So if anything, the financial losses, and it wasn't Georgetown's fault necessarily, as Joy pointed out. The Balanced Budget Act actually created havoc at every teaching hospital in the United States. So this wasn't a unique Georgetown problem, but it was exacerbated by the fact that we had leadership changes at the same time. It's also going to be one of the reasons that we're succeeding, because we have stable leadership. But at the end of the day, it's about leadership.
So in that environment, with so much disruption and with the losses the university was seeing, Joy, why was MedStar interested in partnering with MedStar?
So, so your comment about Helix and Medlantic coming together, I think, is the foundational point that we should make. So, at the time, Helix and Medlantic came together for size and scale, because obviously that was one of the ways in which you could mitigate some of the negative financial things that were happening. But it also came together because it was perceived that there was a strategic opportunity to create an integrated healthcare system within the Washington-Baltimore region. The thinking at the time was that those two cities were reaching out and beginning to coalesce, and that it was becoming the Washington-Baltimore region, and that a well-integrated academic medical system could have a place within that region and could really fulfill a need. And if you think about it, at the time, MedStar had let's say seven hospitals at the time. So we had pretty robust care delivery across that region. We had GME programs predominantly in Washington at the time. And we had a modest clinical research piece to MedStar. What Georgetown offered was to fill out that integrated system by bringing the medical school and connecting the medical students with the GME programs, and also a research engine that could help to drive clinical research for the system. And that research engine included, by the way, Lombardi's NCI-designated Comprehensive Cancer Center. So it was really a strategy of coming together to form a highly integrated academic healthcare delivery system that would be competitive and deliver care in the Washington-Baltimore region.
And Adi, it is obvious why the university was looking for a partner, but what did Georgetown see in MedStar?
I would say that there was not a unified view about this. Let me be clear, because it's important to point out that things aren't necessarily obvious. Yes, we needed a partner that could run a clinical enterprise in the positive, and the larger the system, the better the negotiated contracts. We all know this. I'm not a clinician. You know this better than I do. But at the same time, there were other aspects that were very attractive. First of all, you had a number of hospitals. We had a number of other clinical sites for our students to learn in. There were ways to create research collaborations that would greatly expand what we had. I mean, our university hospital is small. Our faculty is small. Now, we talk about Georgetown as if it's this behemoth, but the fact is, it's a small, mid-sized entity with a long history. And probably the most important thing about it is it's got a really deep set of values and a mission that will stand the test of time. And so when you take that and you combine it with a large system, there was an opportunity here to create something. Now, I say that it wasn't uniform because we had faculty, not just at the medical center, but at the university side as well, that had this us and them mentality. Wait, that's a business. That's a clinical enterprise. We are an academic center. We are a university. We are the ivory tower. And that sense of elitism, frankly, I didn't have a lot of patience for because we had really immediate issues about this, but it was real. And I remember in 99, 2000, as we're going through this, the discussions of, well, wait a minute, that's MedStar. That's them. The university is us. And I could tell you that that discussion quickly dissipated. And by February of 2000, I'm going to read a quote because I went to the Washington Post. February 17th, 2000, the Washington Post talks about this 18-month courtship. And here's the quote from Gabby Hauser, quoted in the Washington Post. Those of you who know Gabby Hauser, the pediatrician. Right. Here's his quote: "Great opportunity for both institutions to marry financial stability with academic excellence." And I will tell you that that kind of goes both ways. There's academic excellence here that we benefit. There's financial stability that will be the greater the sum of the two. That's what we were looking for.
So I started my professional career in healthcare in 1991. And I remember at the time 2 hospitals in Akron, Ohio merging, and it being one of the first mergers at the time. There were so many other hospitals and health systems then thinking about merging at the same time we were partnering with Georgetown, and so many of them failed. Joy, tell us from your perspective, what was it about our partnership that's made us successful in enduring for 25 years?
So I think at the time, I would say that the partnership structure was relatively unique. Today, as you mentioned, and it was just that merger of hospitals and looking at different relationships was just beginning at the very earliest time in 2000. If you look at today, there's all kinds of mergers, acquisitions, academic partnerships, many across the healthcare landscape. That wasn't the case back in 99, 2000. And in fact, I have this vivid memory of standing on the stage in what was then the Gorman Auditorium. Today it's the Goldberg Auditorium, with a packed house of university physicians and associates, very anxious about this transaction, and really trying to say to them, this partnership is aligned with the mission of the university to create knowledge. This partnership will create a new and innovative structure that can be a roadmap for other academic systems that are thinking about developing partnerships. And 10 years from now, we're going to look back at this and realize how cutting edge it was and how smart we were to put it together the way that we did. I think the critical success factor, I guess I would say there were 2 of them. Number one, both partners brought strength to the relationship. And importantly, those strengths were complementary. And I think Adi just talked about that a little bit. They were really complementary strengths. And the academic affiliation agreement, which was the foundational document and structure for the partnership, really supported and facilitated success for both partners across all 3 dimensions: clinical care delivery, education, and research. So I think that was really important. I guess the second comment that I would make is we've talked about it already with Steve, with Ken, with Adi. It's all about leadership, right? Every relationship is about the people in the relationship and the leadership that they have. And There was clear commitment at the highest levels of both organizations. Ken talked about Jack DeGioia's role in it. Ken was COO at the time. Tight alignment there that we were going to be successful with this. And for the clinical faculty at the hospital who had stayed through the difficult times to see this partnership through, there was deep, deep, deep commitment that we were going to make this work because they really realized that if the hospital closed, it put the medical school in jeopardy. And both partners deeply cared about the medical school and its surviving and thriving under the partnership.
Adi, I remember back in 2000, there was a lot of disruption on campus because of our partnership and structural changes that we had to make to be successful. Tell us from your perspective, what were some of the key success factors from the university?
So before I get to the success, let me tell you some of the problems. Because it's important to understand the problem. As this deal was being negotiated, I will tell you that a year before, with all the disruptions on the campus, the faculty senate leadership, there were 4 of us, officers of the Senate, asked to meet with the member of the board, not through the faculty relations committee, which is usually the way we met with the board, but to actually meet with a member of the board separate. That was unheard of. And there were reasons for that that aren't really necessary to go into, but the board acquiesced and sent Win Churchill to meet with us. Winston Churchill, yes, that's the name. And he was an extraordinary individual that listened very carefully to what the concerns were. Now, I have to tell you that the Senate at the time, whatever you think about faculty senates that are curmudgeons and they're complainers and what have you, I could tell you that the history at Georgetown has been very, very different. That we view the role of the Senate as not supplanting the leadership, but actually being a partner in making decisions. We each have our roles and we are interdependent on each other. And Jack DeGioia understood that and appreciated it. And Win Churchill facilitated it. And so I would say as we entered into this, I know I say we, as you entered into this relationship and to this partnership, there were things that came up that people were scratching their heads. For example, do you know that the agreement called for a transfer of tuition dollars to the health system? Now, I have to tell you how radical that is. Every single medical school relies on the dean's tax, which is funds from the clinical system to come and support the school. This was going to do the reverse. A significant percentage of the tuition was going to the health system. And the university faculty, not the medical center, but half of the medical center faculty were saying, are you crazy? That's not what we do. What are we doing? And yet there were those of us who said, stop and think a minute. There's more clinical teaching going on in clinical venues. Who's going to cover those faculty that are leading clerkships? It is really our responsibility to be sure that the system has the funds in order to ensure that the education takes place. In other words, this was a demonstration of shared risk. And that was an important piece. Now, of course, part of that agreement was as the hospital recovers and as the hospital begins to make profit, then the university will share, the medical school will share with that. And so there's a perfect example of shared risk. And so not to look at the small switch here, wait, we're doing it differently than every other school in the country. No, this is actually the way it has to be done to ensure that. Now, how it's actually being translated, I'll let you figure that out. But the fact is that was a huge step. And the reason that it went through is because we trusted Jack. The Senate had a great relationship with Jack DeGioia, and he understood the institution. He'd been there for 25 years. We had great respect for John McDaniel, but we had even more respect for this gentleman, Ken Samet. And then as the individuals that came in that took over, and Steve Evans is brought in. So here's someone who I'm going to embarrass, was a member of the faculty senate when he first came to the medical center. And then he's chair of surgery. And then he has a whole different role in the hospital. And so the faculty trusted it. And so at the end of the day, this was not just about innovative approaches. This was about leaders in place that captured the confidence of the workforce of all of us.
Sounds like a lot of strategy, leadership, and execution.
Totally.
Last question. Looking back over the last 25 years, can each of you share some of the things you're most proud of that we've been able to accomplish together?
So I'm going to go back to the then and now in a minute that you started with, Jamie. But I think what I would say is what I'm most proud of is the success of both partners, right, across research, education, and clinical care delivery. I think we got that part pretty good. I'm going to give you some then and now, though, because you started out with that. So on July 1st, and I'll start on the clinical side. So on July 1st of 2000, the inpatient census at the University Hospital was 68. Right. This year,
068.
68. The inpatient census at Georgetown since the opening of the Versandig Pavilion has been more than 400, right? Back in 2000, the neurosurgery department had 2 neurosurgeons. They were operating only at Georgetown. Today, there are 26 neurosurgeons operating providing care at 30 destinations across MedStar's DCDN. In 2000, there were 5 GI physicians in the Department of GI. Today, there are 41 providing care in 28 sites across the DCDN. And finally, in 1999, the University Hospital did 30 solid organ transplants. Last year, we did 550. So if you look at that, think about that in terms of the access and the ability of patients across the region to really have access to all of the parts and pieces of this partnership, not only the clinical care delivery, but the opportunity for clinical trials and the opportunity to be part of what's happening from a research perspective, pretty significant. If I talk about education, right, residencies have grown since that period of time. But I think even more importantly, what I'm really proud of is the integration of the clinical faculty and GME with the students in the school and how that integration has enhanced the educational environment and learning for the students in the medical school. And then from a research perspective, I would just say, look at today, right? We have Steve and Norm leading a strategy session around how are we going to do research together going forward. We've had 15 years of constant renewal of the CTSA. We've had several renewals of the NCI grant for cancer research. And then finally, look at this symposium. Who could have thought that this would be where we would be sitting today back in 2000? So I think we all who took part in this over the last 25 years have a lot to be proud of.
I certainly did. Adi, what are you most proud of?
How about most? There are things that are near dear to my heart that I'll articulate in a minute, but I just want to stop and think a minute. Just imagine that we weren't partners. Imagine where we'd be as 2 independent organizations if we weren't partners. What a loss that would be, right? So what I'm most proud of is that, we not only figured out how to overcome the obstacles, and there are always obstacles. There are always, I hate to imagine how many transfers go back and forth and how many accounts. So, this is not an easy thing to do. But the fact is that we're much better off together than we are apart. We've synergized. We've advertised this. We had Holly Humphrey of blessed memory, who was a keynote speaker. And why do we bring her? We brought her, sure, come and talk to us. You're the president of the Macy. So that's 2A. I want you to come and see what we have here. So you go back and say, oh, that's different. And the person that's been most influenced by the visit was David Scorton, the president of the AAMC, who now uses this whenever he talks about successful mergers, talks about the Georgetown MedStar Georgetown. I mean, it depends on the context, which one comes first. But the fact is that this is a model. So what I'm personally most proud of is our partnership. This is now you and me, Jamie. I was asked by Howard Federoff in 2013 to create a center to advance the educational mission. I didn't know what the hell that meant. I don't know if he knew what that meant. But what we decided is we're going to invest in faculty, and we're going to empower individuals and nurture them that want to spend time in education. So it's not all 6,000 in MedStar and 2,600 at our medical center, but rather it's really a core of individuals that will influence how we train students and residents. And so we've done that together. And so from the get-go, it's always been together. We did 3 international conferences. We have a teaching academy that actually started in 2015. Today we had a little summary about that. There are more MedStar faculty that are affiliated than university-based faculty. Now, of course, you have more numbers, but still, the fact is that this is an us. This is a we. This is not a us and them. It's together. And the reason we show the two is simply to show everyone, hey, this is really one unit. I think about the LIC, the Longitudinal Integrated Career Clerkship. That's based in Baltimore, but actually we need a few more of those in different places. So Joy really talked about the research accomplishments, the educational accomplishments. I look at the whole vision, the whole package, and say we're much better off together than we were apart, and we only have more to grow.
Well, I think I speak for everyone when I acknowledge and thank both of you for your courageous leadership back to 2000 and for the last 25 years. I know we've had to make a lot of very difficult decisions to be successful. Sometimes it's not choosing what you do, it's choosing what you don't do. And we had to make a lot of those choices. But very grateful to both of you in your leadership roles and the impact you've had, not just on us here, but our community in Washington and Baltimore. So thank you both.
Thank you.
And so, well, thank you, Adi, Joy, Jamie, both for your leadership in planting the seeds and growing this. Thank you for sharing it. I hope you're as proud as I am just to look out at this audience and at the research, the education. We've just built a tremendous academic health system together. And Adi, I agree with you. Whether it's at the AAMC, a couple of weeks ago, we were at PCORI, we are being held up more and more as the role model academic health system. I belong to a network of chief scientific officers for health systems, and they often ask us how we're doing things. So thank you for planting those seeds, and thank all of you for nurturing and cultivating those seeds into what we are becoming now, a nationally acclaimed academic health system leading the way to advance health for all in our community. So thank you. Well, today is been a celebration of research and academics, and it's a celebration that takes a lot of work by a lot of people, and it's my joy to be able to thank a couple of people. We had over 600 people that submitted abstracts to present here. We only had space for about 300. We had 200 people involved in the educational colloquium this morning, and more than 1,000 people have pre-registered. We had over 300 walk-ins. So again, the numbers just say something about the movement that we have going on here and the importance of research and education. Ken, your words were perfect. It is embedded. It's who we are, and it's why this partnership is so important and works so well. It's who we are, and the work today really demonstrates that. But as you know, this doesn't just happen with a click of your fingers. There's a lot of work. We actually start planning this just a couple of weeks. We take a break for a couple of weeks, but we start a couple of weeks for the next year. So I just want to thank Jay Khanna and Jonathan Davis for being the chairs of our organizing committee. We have an organizing committee that I'll show you has about 40 people. We had the residents and fellows do oral presentations right before this from 2 to 3. And there were needed to be a vetting process to look at the best science. So there were a number of people, about 40 people, that did peer reviews of all the abstracts. Arthi Shenoy, Ken Fang,
thank you so much for organizing that to review those 600 abstracts, to pick the 300 that would be here, and then the handful that were presented. On the next slide, yes. So every month we would get together early in the morning and talk about what do we want to do this year? What worked well last year that we want to keep? What do we want to change? Every year we do additional iterations. We're trying to keep the corpus of this that worked so well. But for example, we added the digital posters in the corner this year. So again, the list of names, it's too long to read through, but it's a diverse group from academic chairs, clinical leaders, educational leaders, researchers. A special thanks to our philanthropy team. This could not be done without them. I see Ashley right there in the red, who has led Ashley Sladen, who has led that philanthropy events team along with Gabrielle and Eva. A very special thanks to Lynn Smolnov. Lynn, for 25 years, has been involved in philanthropy, and for the last 10 years has developed the relationship with our corporate partners to help underwrite this. Communications team, lots of communications, both internally with those people presenting to those that are attending. Just want to thank them all. And in mentioning philanthropy, a special call out also to our partners, our corporate partners. I think it's on the next slide. So Dr. Evans went through this. I won't read each name, but it really is important. We are living in very tight, demanding physical times. You can't do an event like this in a responsible way without the partnership with these partners. It makes the difference. It allows us to do it in this beautiful venue like this. So thank you to all of you. Yes, let's give them the hand. I also want to recognize those that are behind the scenes. Well, actually, today they're sitting in the front row. But the Research Institute, MedStar Health Research Institute, has a board of directors, and this is a national board. It's almost like an internal think tank. So they are there that advise us, they advocate for us, they even do a little agitation and push us. So, for example, tomorrow when we have our board meeting, we're going to be talking about the use of AI in research, and we're going to be talking about how to increase diversity in clinical trials. These are important topics, and it's this board that helps through these discussions, through the very diverse perspective, that helps drive us, helps push us to take on what's the next thing. Let's think down the road a little bit. I just want to thank all of you. I see many of you sitting in the front row, and many of our alumni that come back because we're always part of the family. So thank you to our board of directors. Next slide. Next slide, please. So we had a number of awards given out. Too many things to go through. Again, we recognize the top scoring abstracts in different categories in the oral presentations. Want to also recognize the best oral abstracts from the Centile Colloquium. Both Elizabeth and Vaughn got the Best Oral Abstract Award. Again, we have expanded. We started from a research-only symposium to truly a research and education, and this is the scholarship of education. So again, a round of applause for both Elizabeth Selm and Sonia. And the last section I want to recognize are our commitment as an academic health system to the next generation of advancing health. And we invest in our next generation in a number of different ways. The Teaching Scholars Program has been around since 2009, the Research Scholars Program since 2014. These are dedicated 2-year longitudinal curriculums for those that want to be scholars of education or independent investigators, respectively. For those that are part of this program, they get 20% salary support. They get together every month with their peers and go through this program. So on the next slide, I want to go through, and maybe what we'll do is hold the applause until we get through all of the people. First, we want to recognize those that are graduating the MedStar Teaching Scholars Program that are listed on this page. There are a number of people that already are leaders and emerging leaders in the Scholarship of Education. On the next slide, you'll see the graduates of the Research Scholars Program. These are, again, people that are just now ending their 2 years. On the next, you'll see on the cohort that is starting for the MedStar Research and Teaching Scholars. They're going to be beginning very soon for the next 2 years. So with that, I want to congratulate all the graduating and incoming teaching and research scholars. So if you think about a cohort of 5 in research scholars in the first year, 5 in the second year, 5 in teaching scholars first year, 5 in the second year, that's about 20 people that are in a scholars program with 20% salary support. None of this could happen without the dedicated faculty. And they are really dedicated faculty. These are mentors that believe in the scholarship and are dedicating their time to work with scholars from across our system. Rachel Scott leading the research scholars with Federico, Kristen, Jason, who is our founding, Amy Burke, who's been there since the beginning, Elizabeth Shala, Ming Ho, and Stacy Coltzman. Thank you to our faculty for the scholarship program. And the last section I want to recognize is the MedStar Academic Investment Fund. So several years ago, even as we were in COVID, we had a conversation with Mr. Samet about investing in our next generation of educational and research leadership. And how are we going to do that? Made a multi-million-dollar, multi-year commitment to do that. We set up a program, a very rigorous program with a rigorous application process to be able to get an award that would support you for educational fellowship, research fellowship, tail funding, and seed funding. We have, have had about 50 people go through this to some degree in one of these programs or in tuition support in the first 2 cohorts. Again, want to recognize those that are in the first rounds of this and ending. There's the second slide. A number of people just, again, not too many to go through, but if you see somebody you recognize, go up, congratulate them, ask them how their award is going. Again, each of these people have about 20% salary support. You're thinking across, I just said there were about 20 people in the scholars program. There's actively about 20 people in the investment program. And I am very pleased to share with you for the first time, round 3 of the Academic Investment Award. These people will be starting July 1st, getting an award again to support their research or educational development. So let's congratulate all of those academic investments. The future is bright, and despite all the headwinds, all the attacks on independent thought, it is flourishing here. And you should all be very proud of it. It really is something. Well, as you heard, this is a celebration. Next slide, please. This is a celebration of our partnership. And it is just phenomenal to have a like-minded, enthusiastic, smart, ambitious partner in that building that academic health system of what it's going to look like. How is Georgetown and MedStar together going to not just be the role model people are talking to, but be the driver of what academic medicine looks like in the future? I want to invite Norm Beauchamp up, the Executive Vice President for Health Sciences and Executive Dean of the School of Medicine. Norm is coming up on his 1-year anniversary, and we asked him to just share with us a little bit about why he came here, what he has observed in his first year, and a little bit of reflection on the day. So with that, Norm.
I do think regardless of my title, I'm just glad to be here. So thank you. I was reflecting on why I came here, and then Ken actually explained it to me when I was sitting by him. It's for the fun part. And in fact, that's really true, because if you can be a part of something where you're lessening the struggles of others on an extraordinary scale, that is absolutely fun and fulfilling. And that's what I see here. The fun is in doing something that matters. We live in a world where people struggle way more than they should, way more than is just, way more than is right. And when I was in Michigan, we'd had the chance to maybe spend 8 years doing a lot for the state of Michigan and improving health. I promised my mom I would come back. You got to honor what you promised your mom. We made big impact in health. And I was thinking about how could we do something at a national level and maybe a global level. And I was just spending a lot of time, where's the place you could do that? And then I was contacted about this opportunity with Georgetown and MedStar. And so, as we Jesuit institution people like to say, I started my discernment. So what I did is I started studying Georgetown, and I said, is it real? Is their commitment to these values manifest? And what I saw was it really was this existence to serve. And then I met Jack DeGioia, President DeGioia, and I saw that this man believed deeply every single day, and you could see it in the organization. I said, okay, right? We believe in checklists in medicine. So I was like, check, good. And I started studying this organization, MedStar. Studying MedStar. First, I tried to schedule an appointment, right? You got to test that. Easy to do. Like, good access. But more importantly than that, I saw 10 hospitals and 400 locations of practice that were taking care of the most needy in DC and in Maryland without a focus on ability to pay, but a focus on need. And they were doing it with excellence. And I'm like, yep, that's it. And then I studied this Ken Samet feller, Ken Samet. Now, what I found out first was that he's a U of M grad, and I'm a Michigan State grad. So that is a very poor place to start. Then I found that he actually made the company colors, maize and blue. And but there's a saying that I really like. John Adams said this. He said, if your words and actions cause people to dream more, believe more, do more, or become more, you're a leader. And that's Ken Samet. It's Ken Samet. And when I studied the history of MedStar, where it started, how it grew, how it executed, I was just so inspired. And so then I said, all right, so we've got these two great institutions. They talk about what was 24 years of partnership, a 50-year agreement. Is it real? All right, so flew here to DC. I sat in the office of President DeGioia. Ken Samet came and we sat for 2 hours. And what I saw was that it was very real. This deep commitment to transforming health. Not only was it real, they were both challenging me to come here and accelerate and exponentiate the partnership. And what they both did is committed to me that if I did come here to do that work, one, it would be fun, and it has been, but more importantly, it would be meaningful that we would get to a pace and an impact that would meet this sense of urgency that I have, that we have to help people. Now, as many of you know, President DeGioia got sick not long after I decided to come here. But his presence still echoes in the amazing people that I've gotten to work with. It's everywhere and it's every place, and it's really significant. But a really meaningful thing that happened, Ken Samet texted me next day. He said, I want you to know I'm here for you. What do you need? How can I help? I know now that the lift that you came to help lift is more, and I'm here. What can I do? And I'll share that it's probably every other week I get a text from Ken Samet checking in. How's it going? What can I do? Can I help? And it's been remarkable. I will say I texted Ken maybe 6 months in, maybe 4. And I think I duded him. I'm like, dude, how did you get so many amazing people here? Because the core values of this team, the way they execute, right? My partner, Steve, Neil, Jamie, Joy, you just run the gamut, right? John, Jess, Ed. This is an organization, Bill and back, that is here, that's all about how do we excel and how do we partner. It's been terrific. So I'm here to lead a rousing round of applause for MedStar. So what did I do after that meeting? I went home and I asked my wife, because she's the boss in the Beauchamp family, I said, I think we may be blessed to be a part of something that really matters, to be a part of an organization that together can truly hasten the pace of bringing health and hope and healing to all people. And that has been everything I hoped it could be. Now, my son ran track for Michigan State. You got to have a sports metaphor if you're going to get up at a podium, right? And we were sitting at a dinner, and my son looked over and he saw there was an Olympic runner at the table next to us. And Luke said, I'm going to go talk to him. I'm like, good on you, son. That's awesome. And he came back and I said, well, it was Meb. And he said, what did he say? He said, well, I explained to him that in many races, my son ran the 1 mile. I'm out front, and in that last leg, I fall behind. And Meb said, you got to shoot out of the corner. Shoot out of the corner. Now, one of the things that happened with that, which was unfortunate, is in the next 3 or 4 races, when my son was in the final corner, I would yell, shoot out of the corner, son. He said, Dad, enough of the shoot out of the corner stuff. But what it also means is what that means is that when you're out front, you drive. You don't slow down because it matters. And you lose the benefit of the 3 laps and the distance if you don't shoot out of the corner. And what we have here is we actually do have about a 23-year head start. The current model for academic medicine is not sustainable. It's not sustainable because you got your research here and you got your clinical excellence here. And a few other institutions have figured it out. You see it with Vanderbilt. They kind of separated it. You have a health system that executes, you have an academic institution that executes, and then you connect. Where MedStar Georgetown figured that out in 2002. And we've got this amazing infrastructure with MHRI that's really getting it. We've got a nursing school with an awesome leader and a school of health and BGE, the School of Medicine, law, policy in the nation's capital. And we have an opportunity to lead, to be the exemplar for what an academic health system looks like. Too many academic institutions are about how do you come from wherever you are to one hospital. But what we can do is bring that care to 400 sites of practice in ways that few places can. And that's what I'm really excited about, that level of integration. And I see that here, and I see that partnership. And if anybody worries about the future of health, to go to the commencements that we had for nursing, for the School of Health, the School of Medicine, so uplifting. Or if you just walk down any of these, what do you call these, aisles? Again, we're creating that future. It's really exciting. Now, we have more to do, but we're all over it. So what are some of the more to-dos? We're bringing together simulation. I think that that's an incredible opportunity because interprofessional education, right, industry partnerships, it will allow us to bring together strengths across Georgetown and find economies. We're more closely linking our research. This day is an example. Neil allows me to sit on his board. I feel really fortunate to do that. And that work, incredible. Anna, Elliot, the work they're doing, terrific. Educational scholarship. Adi, Jamie, really incredible. I think we have to better align our strategic plans. I feel like MedStar's got an incredible strategic plan. Georgetown's got an incredible strategic plan. We got to link them better. And my prior institution, I worked with a number of health systems. I was never invited to be inside of the tent like I am here. I'm on the board of MedStar Georgetown University Hospital. Ken allows me to be on the board of MedStar Strategic Planning. And as we had conversations, and Steve and with Joy, we just agreed we could bring it closer together. And so now Steve and Joy and I are having meetings to talk about what aligned strategic plans would look like. Steve and I and the academic chairs met this morning to align the work that they're doing. And the whole point is come fall, we'll bring together the strategic plans. I think that's critical. Then it's just vision, tactics, initiatives, timelines, and we got it, right? Straight shot. We need to better align philanthropy, but we are. Jess has been amazing. We recruited Jackie Wood. We need to find more ways to support the mission of all of your work, and we're doing it at a pace that's absolutely remarkable. Absolutely remarkable. And so, as I get ready to close, my observations, my final observations, is I haven't been at a place that has an equivalent concentration of people committed to do good for others. I think this place changes you. I came here pretty committed to humankind and doing good. But when you're surrounded by so many people that every single day are just going after it, you're like, yeah, there's a higher harmonic and I want to hit it, and when you see what's being created. So that's my sense. There's a higher concentration and ultimately the opportunities to do even more good. It's in this room. It's our future. The time is now. Time is here. So just thank you. And now I get to do one really cool thing, which is to invite Steve Evans up. But before I do that, I got to tell you, this guy is a force of nature. Have you ever tried to keep pace with Steve Evans? There's a joy in it because he eats, drinks, sleeps, make a difference, support people, lift them up, remove obstacles, get it done. And it's just been absolutely fantastic. We are in a 3-legged sack race, and it couldn't be a greater joy. So again, God bless MedStar, God bless Georgetown. It's really a special partnership. And thank you all for letting me be a part of it.
Thanks so much, Norman. Thanks for those kind words. And we're all so pleased that you're here. So this brings us to a close. Start with the theme, though, of gratitude. We're so grateful for all the investigators and for all the questions that were asked today. We're thankful for the great leadership that we have between the university and within MedStar Health. but we're also really grateful for philanthropy that has helped support this. And in that context, I ask you all to join us in the back grand foyer where MedStar Philanthropy is supporting you in a great refreshments and an opportunity to continue to mingle and share each other's thoughts. Thank you all very, very much. Have a good evening, everybody.